Okay, good day nurses. For today's discussion, we will talk about mechanical ventilation or your MEC-vent. Okay, mechanical ventilation provide respiratory support. Okay, isa siyang machine guys. Okay, yung machine na yon tinatawag nating what? Ventilator. Of course, this machine helps the patient breathe. Okay, when the patient cannot breathe on their own or when the patient cannot breathe adequately on their own. Okay, it is delivered either invasively via endotracheal tube or via tracheostomy, or non-invasively naman via face mask for clients who cannot oxygenate or ventilate effectively. Okay, non-invasive by the use of your CPAP or your BiPAP. Okay, na-discuss natin noon. Okay? So, bakit naman tutubuan or bakit naman gagamit ang pasyente ng MEC-vent or mechanical ventilator or ventilation? Ano yung mga indications? Bakit kailangan gumamit niyan? Okay, maybe yung pasyente guys, nagre-require na ng support sa makina kasi hindi na nga kaya ng pasyente to breathe on their own. Okay? So, yung mga pasyente is either meron silang, okay, these are the indications. Okay, merong respiratory failure. Ano pa? Meron silang severe pneumonia. Okay? Or nag-exacerbate ang kanilang COPD. Ano pa yung na-discuss natin? Kapag meron silang ARDS. Okay? Yun yung mga mostly pasyente na gumagamit ng mechanical ventilator. Okay? Now, we also have here ventilator settings. Okay, ventilator settings control how the machine assists with breathing and are determined based on the client needs. Okay, let's figure the table 1. Okay, we have here the different ventilatory settings. Okay, settings to, ito yung binibigay or in-order ni Doc. Okay, na settings ng ating MEC-vent. Okay, number 1 here, we have the rate or DRR, the respiratory rate. So, by definition, the respiratory rate is the breath, it is the number, okay, number of breath the ventilator, okay, yung machine guys, the ventilator gives every minute. Example, 12 to 20 breaths per minute. Oh, di ba guys, yan yung normal na RR natin. Oh, for example guys, ang binigay na RR ni Doc na setting ng ventilator sa atin is what? For example, 16. Anong ibig sabihin yan? Ibig sabihin guys, yung machine or yung ventilator will give 16 breaths every minute per minute. Okay? Yung normal setting is again 20 to 20 breaths per minute. Okay? That's for your RR or rate. Okay? Then next, we also have here our tidal volume. Okay, ano naman yung tidal volume? Okay, it is also the amount of air, okay, delivered. Ano yung, sino nagde-deliver? Yung machine guys, delivered per breath. Okay, the amount of air delivered with each breath. Okay, ang normal setting dyan is 4 to 8 milliliters per kilogram. But take note guys, ang ginagamit dyan is the ideal body weight. Okay, not the actual body weight of the patient. Okay? Example guys, the ideal body weight ng pasyente ay 70 kg. Tapos ang order ni Doc na setting ng ating tidal volume is 6 ml per kilogram. So anong gagawin natin? 6 times 70 equals ilan? 6 times 70 equals ilan? Equals 420 ml. So ibig sabihin guys, yung machine or the ventilator will deliver 420 ml, okay, every breath. Okay? I hope na-gets nyo yun. Okay? Next, we have the fraction of inspired oxygen, the FiO2. Okay, ano naman to? It is the percentage, okay? The percentage of oxygen that the patient receive, okay? It is the concentration of oxygen. Then the room air contains 21% of what? Of oxygen. Again, the room air contains 21% of oxygen. Okay, example, we have here 30 to 100% of FiO2. Okay. Now, for example, ang room air is, anong sinabi natin? 21%. So, the machine or the ventilator may deliver, ilan? Either 30%, or 40%, 60%, up until 100%. Okay. So guys, kapag huminga yung pasyente, when the patient inhaled, okay, for example, 60% nun, it contains oxygen. Okay, 60% contains oxygen and 40% okay contains what? It contains nitrogen and other gases. Okay, ma'am, bakit naman hindi na lang gawin nating 100% ang FiO2 ni patient? Bakit hindi po pwedeng gawin yun? Diba? Remember guys na too much oxygen can also be dangerous. Okay, dahil guys, when the patient has prolonged exposure to high concentration of oxygen, it can also lead to oxygen toxicity. Okay, toxic din yun guys. Okay, then ano pa? Can also lead to atelectasis. Then therefore, it can injure the lungs. Okay? Next, we also have here the positive and expiratory pressure na alam kong medyo familiar ka na dyan kasi na-discuss ko na yan noon. Okay, your positive and expiratory, ano ulit yung sinabi ko? Diba normally, when we inhale, then exhale, our alveoli will deflate. But kapag gumamit tayo ng PEEP guys, okay, nang mangyayari, inhale, exhale, but at the end of our expiration, merong maiiwan na pressure to keep our alveoli open. Okay, we have here example of 5 centimeter of water or 5 centimeter of H2O. Okay. Now guys, na alam na natin yung mga different ventilatory settings, ang next naman natin na gagawin ay kung paano yung machine or yung ventilator will deliver the breaths. Okay, ang tawag doon ay ventilatory modes. Okay, this ventilatory mode will determine kung sino ang magi-start or kung sino ang magi-initiate ng breath. And of course, kung how much resistance the ventilator will provide. Okay, ventilated breaths are initiated either by the machine, tawag doon controlled breaths, or spontaneously by the client, ang tawag doon assisted breath. Okay, let's talk muna about the controlled breaths. Okay, yung controlled breaths, ibig sabihin lang guys, yung machine or yung ventilator mismo ang nag-initiate ng breath. While the assisted breath naman, ang nag-i-initiate naman ng breath dyan ay yung pasyente na. Okay, the patient, spontaneously by the client, ang tawag doon assisted breath. Okay. Then we also have here the full support versus the partial support modes. Okay, full support modes delivered a preset volume or pressure for all breaths, whether assist man yan or controlled. Ibig sabihin lang guys, sa full support, yung machine mismo or the ventilator assists every breath, whether the machine initiate it or the patient triggered the breath. While the partial support naman guys is mode delivered pressure support only for spontaneous breath. So, kung partial support guys, the ventilator will only assist the spontaneous breath. Okay, so ibig sabihin, yung pasyente mismo ang hihinga. The patient will do the work of breathing. Okay, that's the support versus partial support. Now guys, alam na natin ang different ventilatory settings like the rate, the tidal volume, the fraction of inspired oxygen, and the PEEP. Ang next na question ay, how does the machine or how does the ventilator actually gives the breath? Okay, ang sagot dyan ay nakadepende sa ventilatory mode. Okay, unang-una, kung sino ang magi-start ng breath, is it the patient or the machine will start the breath? And second, kung ito ba ay full support or partial support. Okay, under our full support, we have the assist control. Okay, it delivers a set number of breaths. So, nakaset yung number of breath. Okay, for example, 12 at a fixed tidal volume or pressure. Ito na yung set. For example, ito ang set na nabigay, 500 ml na tidal volume. Okay? The client can trigger additional breaths, but ventilatory ensures minimum settings are met. Okay? Suppose, for example, yung nabigay na setting sa atin, we have a rate of 12 breaths. Then, a tidal fix. Ito, fix to guys, binigay ng Dr. Fix, na tidal volume is 500 ml. Now, okay, paano kung si patient hindi siya yung nag-initiate ng breaths, okay? The ventilator or the machine will automatically gives, okay, 12 breaths every minute, and each breath, okay, the tidal volume will deliver 500 ml. Okay? So, yun. Now, also, di ba sabi natin, client can trigger additional breath, but ventilator ensures minimum settings are met. Okay, paano naman? Suppose that the patient suddenly breaths, okay, for 4 additional breaths. Okay, the client takes 4 extra breaths. Okay, anong gagawin? Vent delivers full 500 ml for all 16 breath. Okay, example, gamitin natin ulit yung example na to. Yung setting na bigay, 12 breath. Okay, tapos yung tidal volume is 500 ml. Now, the patient takes, okay, 4 extra breath. Now, we calculate it. Okay, 12 plus 4, ilan? 15 to like 16, okay. So, meron siyang total 16 of breath. Okay, how many breaths how many tidal volume ang marireceive niya each breath? Fix pa rin, 500 ml. So, all 16 breath, okay, will receive 500 ml of tidal volume. Okay, I hope na gets yun guys. Okay? Next, we have partial support. And under partial support, we have the SIMV or the Synchronized Intermittent Mandatory Ventilation. Okay. So, dito naman guys, ginagamit siya kapag yung pasyente ay pwede nang mag-recover. Okay? Kasi medyo decrease na yung amount ng support dito. Kasi nga, di ba, partial support. Okay? The ventilator or the machine will still give, ayan, a mandatory breaths. Okay? But now, the patient, okay, is allowed, okay, to breathe on their own. Kaya nga, synchronized intermittent mandatory ventilator. It delivers a preset breaths but allows spontaneous breath. Okay? Spontaneous breath receive pressure support. Okay, take note guys that the spontaneous breath receive pressure support only. Okay, without guaranteed tidal volume. Okay, we have here an example. Ang rate natin ay 12. Okay, ang tidal volume natin ay 500 ml. Now, again, ulit, the client can take 4 extra breath. Okay? Clients get 16 breath. Okay, kasi 12 plus 4, di ba? So, equals 16 breath. Okay, yung 12 na yun, yung 12 breath na yun, will receive, okay, 500 ml of tidal volume, okay? The 4 breaths, the 4 extra breath, okay, will only be given pressure support. Ayan, di ba? Spontaneous breath receive pressure support only, okay, without guaranteed tidal volume. So, ang makaka-receive lang ng 500 ml is only the 12, yung 12 na naset. The 4 extra breath na spontaneous na galing kay patient, walang 500 ml na tidal volume. Okay, ang only na ma-receive niya lang is pressure support. Okay? Now, ang tanong, ilang breaths ang makaka-receive ng 500 ml? Only the mandatory, okay, the mandatory breaths, which is 12. Okay, 12 mandatory breath lang ang makaka-receive ng 500 ml each. The 4 spontaneous breath will only receive a pressure support without guaranteed tidal volume. Okay? I hope na gets nyo yun, guys. Okay? So, bakit ginagamit ang SIMV, guys? Okay? Dito, guys, gusto kasi nating malaman kung yung pasyente ay nakakapag-breathe na independently or yun yung tinatawag natin na pwede na natin siyang i-wean. So, kung under weaning na si patient o weaning, ang pwedeng mode na gamitin na natin dyan ay SIMV. Okay? Weaning, ibig sabihin pa, konti-konti na natin siyang tinatanggal sa paggamit ng machine or ng neck vent. Okay? Lastly, guys, we have the pressure support. Now, dito naman, guys, sa pressure support, we reduce the support even more. Okay? So, ibig sabihin lang, guys, yan, that the patient must initiate every breath. Okay? The ventilator or the machine will never start the breath. Okay? So, support is spontaneous breath with a preset pressure to overcome the work of breathing. No set rate or no set tidal volume. Okay, let's look at this example. The vent setting. The pressure support is 10 cm of H2O and the PIP is 5 cm of H2O. Okay? Anong napapansin nyo? Diba? There is missing. Anong nawawala? The respiratory rate and tidal volume. Wala tayong respiratory rate at wala tayong tidal volume. Bakit? Anong sabi natin kanina? The patient will start the breath. Okay? Client initiates all breaths of vent, deliver pressure support for each breath. Okay? The tidal volume and the rate vary based on the inspiratory effort. Okay, for example, suppose yung pasyente, okay, nag-breath siya 18 times. Okay, then, okay, the vent will follow. The ventilator will follow. Okay, for example, ulit, nag-breath siya 12 times. Okay, then the ventilator will follow. Okay, sa madaling sabi, the machine simply assists. Okay? Okay, kung yung shortcut nito, the patient will initiate the breath, then the machine now will follow. Ito na ang ibibigay niya kung ano yung nakaset na setting. Okay? That's all. Okay, for our ventilatory modes. Okay?